Hello, hi everyone. Good afternoon. This is Sudhir, and welcome to today's NABH 5th edition webinar. Okay, so we have a lot of participants who are joining, and once again, thanks for people who have already joined. So let us wait for 2 more minutes so the people can join. So in this time, so we can have a video that tells what is Medlearn and what do we do and what problem we are solving in today's world. Okay, over to you, Subhasri. You can play the video.
Hospitals work round the clock to serve patients. Being at the center of the action, hospital physicians and staff must confront every situation and every challenge. They must also keep up with evolving health needs and knowledge through ongoing comprehensive training programs. What they need is a promising solution to ensure a continuous learning journey.
In today's world, technology is transforming life. Be it taxis, food delivery, everything we need is at our fingertips. Education is also going through a transformation, and we are at the forefront in the healthcare industry.
MedLearn is a comprehensive learning, training and skill development platform incubated at Impulsys in India for healthcare professionals to attain the right mix of content, learning and skills that help them throughout their career. The platform offers a wide variety of courses that enable hospitals to meet their employee training and development needs in areas of quality compliance, soft skills and induction. The platform is designed in a way that it enables easy tracking of the real-time status of their learning progress. What's unique about this platform is that it's accessible anytime, anywhere, ensuring quality learning literally at your fingertips. Hospitals can now assign courses and track the competencies of users on specific topics with MedLearn's intelligent assessment tool, which gives them better administrative control. Its superior courseware helps hospitals provide standardized care and bridge skill gaps at every level in the organization. The healthcare professionals will also become more efficient and empowered when their learning journey progresses with ease and at their convenience. Let us unite to improve healthcare in India by spreading knowledge through technology. MedLearn, better prepared for better care.
Yeah. Thanks, Subhasri. So is my voice clear? Can people confirm?
Yes, yes.
Yes, Sudhi.
On the, yeah. On the chat box, can I get a confirmation from the audience? Is my voice is clear?
Yeah.
Yes. Thanks. Thanks for the confirmation. So let us start because it's already 3:08. Okay. Thanks for the confirmation once again. So today's world, I think we can come from there. Today's world needs lot of quality into the system. So you can take hospital or you can take any place where we go or the doctors dealing with or the patients that what they require is a quality treatment. So to get a quality treatment, so they search for a quality place. So how do we judge a place to be quality? So we can't judge or you can't judge. There is a government body that judges that this place has a quality, please go. So that quality is obviously the other name is called as NABH 5th edition, where people can close their eyes and can go there and get their treatments. So for that, at that level of quality, if a hospital should maintain, what are all the things that are needed? Okay. So we need experienced people to get into the system and tell what is that needed. So in that line, I would welcome Elizabeth Johnson, who is into the system, into the healthcare from past 15 to 20 years and knows every bit of hospitals and how they work. So we welcome you, ma'am. Okay. So let me just give you a small intro about what is she, where did she come from. Okay, this will give a glance that yes, the information that is given is from the right person. So research, the list goes on. Okay, but let me just tell you a few things that are very important in her achievement. So she is a recipient of the prestigious Karnataka State Florence Nightingale Award 2014 as the best assistant nursing superintendent, and she has over 30 years of experience in nursing and midwifery. She has worked in many leadership roles as a nursing supervisor, clinical educator, nursing superintendent, and chief of nursing services for prestigious Columbia Hospital, Bangalore. She worked as a nursing director in ISIS Medical and Research Center and chief of nursing in Fortis Hospital. Right now, she is working in Sakra World Hospital, and now she is working as a general manager of quality and patient safety. We welcome you, ma'am. Okay, so it is very important for us to know a lot of information about NABH because the world is changing very fast. Okay, so over to you, ma'am.
Uh, Thank you. There is one correction. I am not General Manager of Quality. I am Medical Safety Officer under Medical Admin. I am working as Medical Safety Officer.
We wish you should be a general manager soon.
Okay. Okay. Thank you. So can I start?
Please, please.
Okay. Please share my. Little more. Can you zoom it? I'm not. Oh, okay. This much only.
Ma'am, you can close the tab if you have any tabs that are
Okay. Oh,
not.
okay. Thank you. Okay. Good afternoon to all. I hope all are doing good. So today my topic is like NABH 5th edition, Road to NABH. So before starting, I just uh, wanted to tell you one statement by Peter Drucker. The best way to predict the future is to create it. So if you want to predict your future, you have to create first. So this is what Peter Drucker says. So can you change the slide? Can you see? I changed the slide.
Yes, ma'am.
Okay. Then I can only do, right? I can only change the slide.
Yeah, you can do it, ma'am.
Okay, fine. Thank you. So before starting NABH 5th edition, I just wanted to know what do we think about when we choose a hospital? When you fall sick, what do we think about when we choose a hospital? Anybody, any chat box? Anything, if you want to put it, you can put it in chat box. Otherwise, I'll continue. So first we will think, does it offer what I want? Okay, whether that service is available or not. Can I afford the services? Are the doctors competent? Is the nursing staff competent? Will the staff explain my condition to me? How is the accuracy of the investigation reports? Am I safe in this place? This is what will come in our mind whenever we fall sick when we select the hospital. So what we think, like whether hospitals are safe or not. Whenever we fall sick, first, as soon as where we are running to the hospital. But whether hospital is safe or not, but you will get a lot of errors. You are taken for the wrong surgery, you get wrong medication, you develop a blood transfusion reaction, you fall in the bathroom and fracture your leg, someone reads your medical file and leaks medical information about you to your friends, you step on a broken needle and injure yourself, and two newborn babies are switched. All these things can happen. It is possible. I'm not telling that it is happening, but it can happen. Sometime it happened also. So so who tell us hospitals are safe? Now we have seen many things like this. So many things are there. Hospitals are not safe. Errors can happen. But so who tell us hospitals are safe? How do we tell the public our hospital is safe? Now that is our topic. So accreditation will tell us our hospital is safe. Then what is accreditation? It is a voluntary process by which a government or non-government agency grants recognition to healthcare institutions.
I'm sorry. Are you changing the slide?
Yeah, can you see?
Ma'am,
No, no, no. It's
actually,
not.
Shubhashri is sharing the slides.
Okay. So,
Shubhashri,
Yeah,
can you
you can
change the
just
slide?
direct her, I mean, for the next slide.
fine. Now I'm in fourth slide. You want me to repeat that second and third?
No issues, ma'am. You can go to the fourth slide.
Okay. Now fourth slide. So accreditation, usually a voluntary process by which a government or non-government agency grants recognition to healthcare institutions which meet certain standards. That means voluntary process. No one will come and tell us that you have to go for an NABH. That is our own interest. The management will decide that okay, we should have quality, and so the management will decide okay, we want to go for accreditation. So that is a voluntary process. And then when we are decided to go for accreditation, then there is standards. It is available from NABH. Those standard book we have to get it. If you meet all these standards, whatever it is there in NABH book, standard book, then the first we should assess ourselves in our hospital as per the standard which it is mentioned in NABH book, and then we have to inform NABH and they will come and audit whether we are following as per the standards. Then we will, if we are following, we will recognized by NABH and we'll get the certificate. Next slide. Next slide. You are changing slide?
Yes, ma'am. Yes, ma'am.
Now when I changed only I was able to see. Okay, so NABH, what is the full form of NABH? National Accreditation Board for Hospitals and Healthcare Providers. That means not only big hospitals, even small hospital also can go for NABH accreditation. So they have different types of standards. For small hospital there is standard, and big hospital also the standards are different. It is available in NABH. And it is a constituent board of QCI, Quality Council of India, and recognized by ISQA, International Society for Quality in Healthcare, has collated now 5th edition standard for hospitals. The main focus of NABH is patient safety, staff safety, environmental safety, and quality of patient care. And why we should go for NABH? Because we want to revalidate our process and systems, because as per the standard of NABH, and ensure that we are doing the right things and doing them well, and significantly reduce the risk of harm in the delivery of care if we follow the standards, and increase the confidence of the public in our service. How we will increase our confidence? Because we can put the logo NABH accredited hospital, and then the public also will will think that okay, this is NABH accredited hospital, they are following set of standards, we can trust them and we can go to that hospital, they will do everything in an appropriate way. That is what the public also will get the impression about the hospital when we go for NABH. And what is the benefits of patient? First of all, NABH divided into benefits for patient, benefit for staffs, benefit for organization. So what is the benefit for patient? Accreditation result in high quality of care and patient safety. The patient gets services by credentialed medical staff. That means at the time of interview itself, they will make sure that they are privileged and credentials. Okay, then again the training, on the job training will happen, and their competency level will increase when they are giving on the job training. So the patient will get good quality care from correct staff or right staff. Rights of patients are respected and protected. Again, that is also very important. All the staff will come to know what is the rights of patient, and because we are giving education for them, as per the rights, we have to take care of the patient. We have to respect the patient and we have to protect their rights. And patient satisfaction is regularly monitored and evaluated. We used to take voice of the customers and some different like even medias. We will take the feedback from the patient. So that is the way even still we can improve. If any suggestions, if it comes from the patient, we can improve the organization. And benefits for the staff, well-defined process and systematic approach. There will be proper standard operating procedures and policies will be there, so that there should not be any confusion. It's not individual driven. It is actually the process driven. Like process should be, one staff is not there, another staff, when they see the process, oh, this is what I have to follow. So that is what systematic approach, and clarity on job description and specification. They all will get what is your roles and responsibilities, job description and specification. That is from HR, definitely they'll be giving. And staff in an accredited hospital are satisfied a lot, as it provides for continuous learning, good working environment, leadership, and above all ownership of process. That means, see, not only the certificate, after getting also the healthcare, we all know that we should update our knowledge. Every day it is changing. So the staff on the job training, and as soon as they enter in the hospital, induction will start, then on the job training, then competency, all these things will happen in NABH accredited hospital. It is mandatory. It improves overall professional development of clinicians and paramedical staff and provides leadership for quality improvement within medicine and nursing. Next slide. And what is the benefits for organization? Accreditation to a hospital stimulates continuous improvement, and it enables hospital in demonstrating commitment to quality care, and it raises community confidence in the services provided by the hospital. It also provides opportunity to hospital to benchmark with the best. So we can benchmark, okay, this X hospital, what about that Y hospital? Y hospital is doing better than this hospital. Maybe we can check that. And that is a benchmark. It also helps for TPA, third party administration, for the insurance and all these things. NABH accredited, nowadays insurance, people are asking about whether it is accredited hospital or not. So that is also mandatory. And then NABH, next, NABH is total 10 chapters. In that NABH 5th edition, there are 10 chapters. Every time it is like 3rd edition, 4th edition, chapters are always same, 10 chapters, and standards sometime will change. It is this time it is 100, and objective elements 651, and key performance indicators are 32. And the first 5 chapters are patient-centered. So that is access, assessment, and continuity of care, that is AAC, and care of patient COP, management of medication MOM, patient rights and education PRE, and hospital infection control, that is HIC. The first 5 chapters patient-centered. The second 5 chapters, patient safety and quality improvement, and responsibility of management, that's ROM, and facility management and safety, FMS, and 9 human resource management, HRM, and the last one is information management system. So this is second 5 chapters management centered, first 5 chapters patient centered. And how are the standard, that book when you take, how it is organized, NABH 5th edition. First chapter incorporates the following: intent of the standards, then summary of the standard, then each standard. Under each standard there are objective elements, then each objective elements there is interpretation. So what we are look for, what we are supposed to do under each objective element, and then glossary and KPI. This is the way they organize the book. Now we'll start one example how it is organized. AAC 14. The chapter is AAC 14. The standard is organization. AAC's chapter, 14th standard is organization defines the content of the discharge summary. That is the standard. Under that standard, there are objective elements A to G. So in the bracket, in each objective element, it is mentioned C. That means commitment. Okay, I will explain next slide. So this is the way KPI is organized in that book. 32 KPIs are there. So even one more column, benchmark also will come, like serial number, standard, indicator, definition, formula, benchmark, unit, frequency of data collection, monitoring, and remarks. It's just example. And this is what I told. C means commitment level, and commitment level again, core objective elements are there. That is CO, that is 100, achievement level A, and excellent level E. This is the way, if you open that NABH book, you will see that different color coding has given this time. So commitment level and commitment level core. It is first time itself, if you are going for a NABH, usually they will say final assessment. That is for 61 plus 100, it is mandatory. That means 561. Achievement level comes, that is next when we go for surveillance. After 1.5 years, there is a surveillance audit. Again, after surveillance, 3 years. That means after 3rd year, we will go for re-accreditation. That time 30 objective element should be there. So total 651. The scoring system is like this. There is no 0 this time. 1, 2, 3, 4, 5. So you can see this chart, how it is mentioned in NABH book also. Like 1 means the percentage, when we are taking 20% and less, that means no non-compliance, and that is poor compliance 2, and 3 partial, 4 good compliance, 5 full compliance. So if we are into accreditation, 61 to 80% samples meet requirement of objective element. 5 is the best. That means 81 to 100% sample meet requirement of objective element. And now we'll start with chapter 1, AAC. These are the intent of the chapter, provides information about the scope of hospital service, like what are all the scope of service are available that particular hospital. When we go single specialty, for example, like OBG and all, you cannot go with the fever. Or when you are so then you should see that what are the scope of services are available in that particular hospital when you are choosing. Then admits only those patients who can be cared. Like some hospital, they won't take burn case. So you should mention which scope of service, which are all the services we are providing, which are all the services we are not providing. That display should be there. And provides life stabilizing treatment to emergency patients and then admit or transfer them to another organization. So before we used to send the patient if they are non-affordable or something, or MLC, sorry, RTA or something, immediately we'll send the government hospital and all. Now it is not like that. First we have to stabilize whatever it may be. After that only we have to decide about the shifting. And conducts appropriate initial and periodic reassessment for all inpatients. There should be initial assessment, then periodic reassessment as per the condition of the patient. ICU is different and ward is different reassessment. And provides laboratory and imaging services that commensurate with the scope, and provides continuous and multidisciplinary patient care. Has a well-defined transfer and discharge protocol. All transfer, discharge, stable patient, unstable patient, all this protocol, that means standard operating procedure should be there. So these are the this AAC chapter summary of the standard. Organization defines, displays the healthcare services that it provides. So display also defines and display. And well-defined registration and admission process. That means there is policy and procedure should be there. An appropriate mechanism for transfer in and out or referral of patient. Organization undergo and establish the initial assessment. So each category in the ward and the ER and initial assessment properly SOP should be there. And by the organization undergo a regular reassessment And lab services are provided as per the scope of services of the organization. There is an established laboratory quality assurance program. Quality assurance program also mandatory in lab, and a laboratory safety program, and imaging services are also the same way lab provided as per the scope of services of the organization. There is an established quality assurance program for imaging service and established safety program in imaging services, and patient care is continuous and multidisciplinary. The organization has an established discharge process. The organization defines the content of the discharge summary. This is what the AAC chapter content, like summary of the standards. Under that, these are the objective element. I am not explaining, total 91 objective element under each standard. You can see that different numbers, scope 4. So like that, total objective elements 91. Next is COP, intent of the chapter. The organization provides uniform care to all patients in various settings. What is the meaning of that? Uniform care means which facility may vary, but your treatment cannot be vary. That means whichever disease condition, whether it is single room, general ward, or suite room, or whichever patient getting admitted, the same treatment to be provided as per the disease condition, and adheres to the written guidance. That means for patient care, organ donation, procurement, there are written guidance, applicable laws and regulations, government laws and regulations we have to follow. And addresses pain management, nutritional therapy, and rehabilitative service. And pain management also very important. We should, like pain score, different scales are there. So according to that, we have to, when the patient admit, we have to assess the patient as per pain and nutrition, all these things. Then we have to reassess and we have to follow. And guides and encourages patient safety. This COP. That is the intent of the COP chapter, and summary is uniform care to the patient is provided in all settings. Emergency services are provided accordance with the written guidance, applicable laws and regulations. Ambulance services ensure safe patient transportation with appropriate care. So that means stable patient, unstable patient, how you are shifting or transferring the patient from one facility to another facility. All these things should be SOP, proper SOP should be there. The organization plans and implements mechanism for the care of patients during community emergencies, epidemics, and other disasters. So there should be a plan, contingency plan also should be there. And cardiopulmonary resuscitation services are provided uniformly across the hospital. That means code blue. We will announce code blue. It is a code which is using every hospital to whenever there is cardiac arrest or respiratory arrest across the hospital, that is mandatory. Code blue announcement, that is whenever there is a crash. And nursing care is provided to patient in the organization in consonance with the clinical protocols. And clinical procedures are performed safely. Any clinical procedures we have to perform safely, and we have to follow infection control protocol also. And transfusion services are provided as per the scope of service of the organization safely. The organization provides care in intensive care and high dependency units in a systematic manner. And the organization provides safe obstetric care. Organization provides safe pediatric service. Procedural sedation is provided consistently and safely. And anesthesia services are provided in a consistent and safe manner. And surgical services are provided in a consistent and safe manner. The organ transplant program is carried out safely. The organization identifies and manages patients who are at higher risk of morbidity and mortality. Pain management for patient is done in a consistent manner. Rehabilitation services are provided to the patient in a safe, collaborative, and consistent manner. Nutritional therapy is provided to patient consistently and collaboratively. End of life care is provided in a compassionate and considerate manner. End of life care form should be there. We should get the signature from the patient relative, and we have to respect their culture also. Next is this is the objective element. Again, I am not reading. So there are 142 objective elements are there. Care of patients, that chapter is very, very important. Like all the chapters are important, but care of patients, directly the care will go to the patient. That is why care of patients chapter is very important. Doctors, nurses, all of us. And next is MOM, intent of the chapter. The organization has a safe and organized medication process to ensure that the pharmacy has an oversight of all medications stocked outside of pharmacy. There is a mechanism to ensure that emergency medications are standardized, readily available and replenished in a timely manner. As a mechanism for safe use of high-risk medications, safe is paramount when using narcotics, chemotherapeutic agents, and radioactive agents. There should be a process for monitoring a patient after medication administration, has a procedure for reporting and analyzing near misses, medication errors, and adverse drug reaction, ensures availability of medical supplies and consumables. Medication includes blood, implants, and devices. So this is the summary again. Pharmacy services and usage of medication done safely, and organization develops updates. Same thing only, because I think time is little going fast. Medications are prescribed safely and rationally. Medication orders are written in a uniform manner. That means only in the drug sheet medication prescription should happen. Progress note, other forms and all should not write. Medication are dispensed in a safe manner. Double check should happen from the pharmacy. Medications are administered safely. High risk medication with 2 nurses, and it should be under lock, and patients are monitored after medication administration. After administration, we have to monitor the patient as well. And narcotic drugs and psychotropic substance, chemotherapeutic agents and radioactive agents are used very safely. We know that we have to follow all narcotic drugs, double lock, etc. And psychotropic drugs, how to use chemo medication after administration, how to discard in case of any remaining, all these things we should know. Protocol should be there. Implantable processes and medical devices are used in accordance with the laid down criteria. Whatever we are using, implants and all, in the discharge summary it should mention all numbers, their serial number and all, batch, etc. Medical supplies and consumables are stored appropriately and are available when required. That means all the medication, especially crash cart medications, always it should be available across the hospital. So these are the objective elements 68. Next is PRE. The intent of the chapter is the organization defines, protects, promotes patient and family rights. Patients are informed of their rights and educated about their responsibilities at the time of entering the organization. Inform patient about their responsibilities. This is actually nothing. All patient rights and responsibility already there in that chapter. And all the staff should be aware of patient rights and their responsibility, and we have to educate them. So that is very, very important. In case if any rights are violating, that is patient rights violation, that also we should raise incident and see that where we can improve. This is the summary of that standard PRE. The organization protects and promotes patient rights, responsibility, patient and family rights, support individual beliefs. We should believe all the patients, their values and their beliefs they have, like Christians, Hindus, Muslims, whatever. We should respect their demands when they are in ICU. All these things we have to, we should make sure that we are doing it for all the patients. And then inform consent. When we are taking the consent, so we have to inform, and simply we should not take the signature. Inform everything, whatever the content is there in that consent form, and then take the signature. That means the patient is understood everything, or patient family is understood. After that only we should take the consent. That consent is always, it should be taken by doctors. And patient and families have a right to information education about their healthcare needs. So we have to, they have the right, we have to communicate with them. And the patient and family are right to information, expected cost, and then their mechanism to capture patient feedback. That is what we told. VOC, we used to take VOC and all other social media, we can take their feedback and we can improve the organization. The organization has a system for effective communication with the patient and family. So simply we can remember They should patient rights, cost, appropriate care, and communication and consent, confidentiality, privacy, everything we should maintain. These are the rights. Responsibility, patient responsibilities, they should tell proper medical history and they should follow hospital protocol, visitors policy, no smoking policy, etc. This is PRE. Total objective elements are 53. And HIC, intent of the chapter, the organization implements effective healthcare associated infection prevention and control program. All organization there should be infection control program should be there. Aims at reducing and eliminating spread of hospital acquired infection to the patients, visitors and healthcare providers. Ensures documentation of the program. The program is implemented across the organization including clinical areas and support services. The organization provides adequate facilities and resources. That means everywhere there should be hand rub, wash basin, above that the hand hygiene steps, 5 moments of truth, all these things should be there. It should be available in the hospital. And the organization measures and acts to prevent, to reduce the risk of healthcare associated infection in patients and staff. Adopts appropriate infection control measures, implements and infection control measures like many things are there. Infection control program, hand hygiene, biomedical waste management and critical care area HEPA filter, staff safety PPE and then isolation rooms, and for staff annual health checkup and vaccinations. All these things are under infection control program. Then antibiotic policy. And HIC again, this is a summary of the standard, same thing only. Total objective element 51. And next is PSQ. Intent of the chapter is the standard. PSQ is patient safety and quality. The standard encourages patient safety and continual quality improvement, ensures documentation of patient safety and quality program, ensures that the program involves all area staff members including department leaders and management, implements national, international patient safety goals and solutions. So every hospital there should be international patient safety goals or WHO patient safety solutions. There are 9 safety solutions. So that we have to follow. And collects structure, process and outcome data, especially in high risk situations. Performs quality improvement activities using appropriate quality tools, for example, clinical audits. I think as per 5th edition, each department at least yearly one clinical audit is mandatory. Clinical audits shall be used as a tool to improve the quality of patient care. The organization should have a robust incident reporting system. That is very, very important. Incident reporting system. Any incident, any process deviation, immediately they should raise the incident and we should have a, brainstorming and RCA, CAPA to be done. RCA, root cause analysis, CAPA, corrective action and preventive action. And in case if any sentinel event, there should be committee. Sentinel event is permanent damage to the patient or death. So you can see the definition in NABH 5th edition. So we can say one sentence, permanent damage to the patient or death is sentinel event. The management should support the patient safety and quality program. So these are the summary of the standards. This is again type of incidents. As I mentioned, incidents are very, very important. We have to raise the incident. There are near miss. Near miss is an unplanned event that did not result in injury, illness or damage, but had the potential to do so. That means about to give, but it is somebody involved, intervene or they themselves will identify and then will stop. It is not reached to the patient. That is what near miss. No harm is certain things it will reach, but nothing happened. For example, maybe without order, when paracetamol has given for the patient, but nothing happened. But it is, we are not supposed to do. No harm, but that is what C category. There are different categories. And adverse event, an injury related to medical management in contrast to complications of the disease. And medical management includes all aspects of care, including diagnosis and treatment, failure to diagnose or treat, and the system and the equipment used to deliver care. Adverse events. Adverse event, we can say that from A and B is near miss. All C to I categories are adverse, but the severity will vary. And sentinel event is the a relatively infrequent, unexpected incident related to system or process deficiencies, which leads to death or major and enduring loss of function for a recipient of healthcare services. Major and enduring loss of function refers to sensory, motor, physiological, psychological impairment not present at the time service were sought or begun. No, because of negligence, if anything happens, that only sentinel event. The impairment lasts for a minimum period of 2 weeks. If the patient is supposed to be 2 weeks because of our negligence, that is also sentinel event. So next, PSQ objective element, total 49. Next is ROM, responsibility of management. Ensure that the management is aware and manages key components of governance, identifies those responsible for governance and defines their roles, encourages governance both professionally and ethically, defines the responsibilities of management and leaders of all levels, ensures that the management execute their responsibility in compliance with all applicable regulations, ensures that patient safety and risk management issues are considered by leaders as integral part of patient care and hospital management. So we have statutory requirements, that also the management responsibility, all statutory requirements we have to follow. And then ROM, summary of the standard, the organization, same thing. Okay. Then objective element total under, sorry, 32. Next is FMS. FMS is Facility Management System. Intent of the chapter is aims at provide safe and secure environment for all patients, family, staff and visitors. Many people will be entering inside the hospital. So safety is very important for each and every individual. Addresses issues related to facility, equipment and internal physical environment and performs proactive risk analysis. That is what HERA we should do, and conducts facility inspection rounds and provides staff training on safety. Staff training, sorry, performs proactive risk analysis, conducts facility inspection rounds and provides staff training on safety and disaster management, provides safe water, electricity, medical gases and vacuum systems, implements program for medical and utility equipment management, plans for fire and non-fire emergencies, ensures that the entire premise is a non-smoking area, safely manages hazardous materials, aims at being energy efficient. This is facility management. So these are the standards. Objective element 45. And the next is HRM, Human Resource Management. Intent of the chapter, human resources are an asset for the effective and efficient functioning of the organization, identifies the right number and skill mix of staff required to provide safe patient care, adheres to uniform and standardized recruitment system. There should be criteria for recruitment, orients staff to organization's environment and to their duties and responsibility. That induction program we should inform about our organization, plans for an ongoing professional training service, in-service education for all staff, a systematic and structured appraisal system for staff development, and promotes physical and mental well-being of staff, ensures grievance handling mechanism. There should be grievance handling mechanism or SOP should be there, disciplinary procedure should be in place, ensures credentials and privilege for all healthcare professionals, doctors, nurses, whoever is healthcare professional, that there should be credentials and privilege, what they can do, what is their qualification and how, like then later they can competency level we can increase by giving training. A document containing all such personal information has to be maintained for all staff. And HRM, these are the summary of the standard. Objective element, total 46 are there. The last one is IMS, intent of the chapter. IMS, Information Management System, ensures availability of right information to the right person at the right time, includes management of hospital information system and all modalities of information communicated to staff, patient, visitors, and community, directs data and information management to meet organization needs and support deliver of quality patient care, provides authentic, secure, and accurate information needs, maintains confidentiality, integrity, and security of records, data, and information, especially it is MRD, EMRD, and MRD. Like some places hard copy, some places soft, and ensures confidentiality of protected health information and safeguards in across all platforms, includes periodic review, revision, and withdrawal of obsolete information in information management, maintains complete and accurate medical records, ensures accuracy and availability of medical records to appropriate care provider, ensures review of medical records at regular intervals. So this is the intent of that chapter. The standards are same. Objective element 44. That's all about NABH 5th edition, but each chapter we should cover 1.5 hours actually speaking if you go so much description. That's all. Thank you so much. Any questions?
Yeah, thank you, ma'am. This is wonderful. Yeah. So, can I get any questions from? So, Kalpana, can you just type your question in the chat box?
So
So, can we
Kalpana
give?
has raised her hand. So you can speak, ma'am.
Okay. Tell me. Any questions?
I think people can type. The audience can type their questions in the chat box. We will take. Okay. So before we close off, just I'll take 10 minutes of the time. So thank you, ma'am, for giving such a detailed explanation of every standard, every objective element, which is very important. Okay. So I think people here in the audience can wondering like, so ma'am has said very fast. How do you learn? Where do we learn these many things? In just 1 hour, it is not possible. Okay.
Yes.
So that's what Medlearn is there. So don't worry. So Medlearn will help you out to get all these things under one roof, so that with just simple way we can make sure that we are. Yeah. So we get all those things. So is my screen visible?
Yes, yes.
Great, great.
Screen.
So yeah. So coming to Medlearn certificate program. So all the objective elements or all the chapters can be done. You can use it. You can take Medlearn's help in completing everything, and you can become an expert in this field. So I think this has been said. What is NABH? Okay, I think I won't get into much of this. Okay, so what are the standards and what should you learn by end of this? It's like 10 chapters should be there in your fingertips. 100 standards, 651 objective elements should be there at your fingertips. So there are two things. One is patient centric, one is organization centric. So patient centric, these all like AAC, COP, MOM, PRE, HICs, patient centric. Organization, so these standards are divided into two parts from the board. So these are all from organization center. So why Medlearn certificate program for NABH is very important, because we help you to get all these chapters with video explanations, with real-time scenarios, with a pre-test, post-test, making sure that you are clearing at least 2000 questions like MCQs before you complete this course. So what is the highlight? So the highlights is that it is a 60 hours learning program, and you will be given like webinars, live webinars every month from NABH assessors and experts like this and quality managers, so that you will know if you have any questions, you can get that answer. So all these are a part of this, like AAC. We need 14 hours to complete this. COP we need 14 hours. MOM is 11 hours that we require. So all these chapters will be given you in a detailed form like PRE, HIC, PSQ, everything, facility management and safety, HRM, and IMS. So the important thing is that you won't get this thing, but what we did is that we have done two more extra modules like introduction to NABH and audit preparedness and scoring system. So whatever there's a scoring, so you can't get this outside, so you can only get in our program. So which there is 1 hour dedicated in our module for this. So who will be able to take up this course? Any hospital administration, any quality manager, any nurse, any nursing students, physician, elite professionals who wants to work for NABH to a hospital, or you wanted to be a part of the committee, or you wanted to be a consultant tomorrow, or NABH assessor tomorrow. So this NABH 5th edition is the first step for you to get there. So coming to the course cost you is 15,000 rupees, and the course validity is for 1 year. The certificate is valid until you get your NABH 6th edition. So once you finish, you will get your training certificate on your completion of NABH 5th edition. So this is a sample certificate with a date, scan code, everything will be there. Okay. So this is a course that it will be covering 10 chapters, 100 standard, 600, 51 objective elements. But there is a surprise here. Okay. So people, everyone who wants to get this program, we are now, as a part of Shivaratri, as a part of Valentine Day, we are giving this course at 50% off, valid till 20th of February. So you will get the course at only 7,500. So you can contact 63 64 51 2505 to get this offer, or there'll be a link that will be placed in their chat box. You can use the link, give your details, and get the payment will be done. You'll get the access for the course. So again, you can save this number 63 64 51 2505. So Subhashri, you can keep this number on the chat box, or you can come back to store.medlearn.com. Okay. So this is what all the things, whatever Elizabeth ma'am has explained, everything in detail this program covers. Okay, so you can use this program to make sure that to become very strong in your NABH 5th edition, where is the stepping stone for you to get into the management part. So this is a payment link, so you can get, and 63 64 52. Okay, 2505 is the number where you can contact us for furthermore. And there are a couple of questions. Okay, so ma'am, over to you. The question is role of internal auditor in NABH implementation. What is the role of
Role of internal auditor. The same
yes,
thing which is mentioned in NABH book, self-assessment toolkit. There is self-assessment toolkit is available. As per that, you should go and check each area. That is what internal auditors' responsibility.
ma'am? Next question. Can you please say something about HERA?
HERA is hazard identification and risk analysis. That means, see, we have to identify proactively, we should identify what is the risk in each area. For example, engineering, some HERA will be there, some risk will be there. So yearly we should identify, we should put the score. As per the score, we should we should see that human property and how it is impact on human and property, and as per that we have to put the score. The score is high, we should try to reduce with the mitigation, something we should do for that, how to reduce it. So this is what HERA.
Okay, great, great. Thank you, ma'am, for that. Any more questions? So, ma'am, one more question. So, how many years it will take for a hospital to get an NABH aggregation? So, it will take 1 year, 2 years, or 3 years, or 5 years.
Nothing like that, because you have to start doing as per the standard. If you implement even 6 months, that depends upon the organization.
Okay.
So it is not that 1 year, 2 year. So how fast you can do it, you can do, because they first of all there is a self-assessment toolkit. It is very important actually. Then we have to make our SOPs. Then you should send it to Delhi like QCI. Then from QCI they will check all these things. They will come for the final. This final assessment called is like first assessment only, pre-assessment. So they will come and audit, and they will tell the gaps. That gaps we have to fill and show them. Then they will come for the next assessment. That is the way actually.
Okay. Now, there is one question that commonly we get when we uh, speak with lot of people who wants to get into this consultant or NABH consultant. Okay, we heard so. For example, I'm a clinical person. I'm a nurse with 10 years of experience. Okay, I wanted to move into management side like NABH internal committee. So, what all the skills should I achieve so that I can move from our clinical side to a main implementation side, NABH implementation,
That
or
is actually NABH site. Always there will be trainings are available. They will highlight that. Sometime it will be there in Bangalore, sometime in different location, different state. So that actually daily we should check that anything is NABH site. It is coming any training. So and when you are going for that training also, they will see the experience. They have some criteria, this many years of experience for nurses, this many years of experience for doctors, see like that.
so one more thing, man. So having a NABH certificate from Medlan, will it help the process little bit easy to understand the concept of everything?
Definitely,
Where energy.
because it's a very detailed, because I just covered within 1 hour all 10 chapters. Actually each chapter will take 1.5 hours, so that will help if they self education. It is easy through Medline, I think so.
So for example, I have taken a course from Medlan. So when I go there, so will I understand the concepts easily there?
Yes, yes, definitely. Because if you, first of all, if you take and study these NABA chapters and all these things, after learning, then you go and attend the course, definitely you will be more, you will get an idea fast.